One of the things that you're going to want to do in the third trimester is to choose the baby's doctor, because your obstetrician most likely is not going to be taking care of the baby once it's born. The reason I say most likely is some family doctors do obstetrics and also take care of babies, but for the most part you're going to need to find a different doctor that's going to take care of your baby once it's born. And so that's something that you want to do before the baby's born, so you know who's going to see the baby in the hospital and who you're going to take the baby to once it's out of the hospital. There's a lot of ways to go about doing this. Referrals from friends is a good way. If you have other kids and they're already seeing a baby, a doctor, then you may have a relationship with a doctor that way. Also, you can ask your obstetrician for advice on who their patients tend to go to for the baby's doctor. There's two sort of big categories. There's family practice and pediatricians. Family doctors do a great job taking care of babies and children, but they take care of whole families, which is a big advantage because they have a perspective not just only from the baby, but they have a perspective from the whole family dynamics. And they can also take care of you if you have a cold or a flu or your other medical problems, as well as your husband and the rest of your family. Pediatricians only see children. The advantage of that is they tend to be better with the more sort of esoteric things. So things that are more unusual, or if the baby's really sick, a pediatrician is probably going to be better suited to handle that. So there's advantages and disadvantages each way. Personally, I take my kids to a family doctor, but pediatricians are also very good. So those are things that you want to talk about and think about as far as where you're going to take your baby. But it's something that most hospitals want you to have that in the pre-registration material, so they know who to call when the baby's born. The other thing is that for most insurance companies, the baby is automatically covered for the first 30 days, but then it's important for you to add that baby to your insurance coverage so that the insurance will go forward with the baby on it. So something to think about in your third trimester: who's going to be taking care of the baby once it's born.
Medtwice.com